Awesome. Thank you. Really appreciate everyone that's tuned in today. I'm super excited to talk about my community. I always appreciate the opportunity to raise awareness about rural-based challenges. I think it creates space to explore innovative solutions and hopefully spark a passion for advocacy. So I thought it'd be kind of nice to get a little bit of a pulse check about who our listeners are today and just to see who has either lived or is currently living in a rural or remote community. In the meantime, please feel free to share in the chat box exactly where you're calling in from. We can do some shout outs to your communities. Oh, we got a lot of people. That's exciting. Awesome. One other person that's not, but Pender Island, Castlegar. Awesome. Now, oh, Quinnell, Clinton. Very exciting. Well, I 63% about us, it looks like, yeah, are have either lived in a rural community. I think that's really interesting. Excited to do our breakout rooms later to see some of the innovative solutions that you may have done in your communities. So we'll explore that a bit further. So just about my community, so Cherryville, BC. As you can see there a little bit on a map, if you've ever been to the Nakusp Hot Springs, you've likely driven through our little town, may have missed it. So Stats Canada puts us as about 700 residents, but we know it's closer to 950 or so. 36% of our total population is 60 years and older. And we have a higher percentage of low income families. About 30% of our Cherryville population is low income. So, some extra things about my community is we are considered remote under some classifications and rural under others. I find it kind of depends on, that's a little bit of a fickle process. If you're looking for grants and stuff, sometimes they say if you're under 1,000, you're considered remote, but there's a little other factors that go into that. So, um, remote, rural, we're both. Generational, we have multi-generational families here. So, for example, my grandparents lived here, my parents still live here, my aunts and uncles all lived in Cherryville, grandchildren. Many families are like that in Cherryville, where it's that multi-generational and it extends back a really beautiful history there. Um, we have incredibly talented community members and many self-employed entrepreneurs, many artists, lots of craftsmen. It's really very rich in talent. And I think that's one of the coolest things ever. I'm always like, whoa, that person's doing some unique things over there. Or you get just to see how artsy it really is out here. And it's really neat to be a part of. And I would say like a major piece of the Cherryville identity is back to the roots. Like when I think of back to the roots, it's homesteaders and families living off the land. Many residents are very conscientious of their footprint that we leave on earth and live mindfully. Very strong ties back to nature. And so we had like a back to basics and those skills and abilities of, foraging and making wool and all those kind of skills that get missed. There's lots of that rich talent out here in Cherryville, and I love that. Um, and lastly, Cherryville is an incredibly giving community. When you hear the term "it takes a village," I definitely think of the Cherryville people. If there's ever a really pressing need or issue, we can put a call out to the Cherryville people, and it really doesn't take long to get an abundance of support, whatever that looks like. Volunteer bodies on the floor, or it's financial or items. We really do have a very generous community. So I thought I'd explain kind of about who we are, our organization. So in 2010, we started out as a food bank and began promoting food security within Cherryville. Interestingly, the president, her name's Sharon Harvey, she started it as a food bank, and that was kind of based on, for many years, our local church here would put on a Christmas hamper. And Sharon had thought, well, if people need hampers at Christmas, they likely need them throughout the rest of the year. So started the food bank in 2010, and it really has grown to be such a huge piece of our community. And we had a lot of challenges starting out, community buy-in being a huge part of that. It took about a decade of building trust and gaining that community buy-in. It's really not a rushed process. Many hardships, including scrutiny and gossip, those kinds of things that you deal with in a smaller community. And lots of those were based on misconceptions around food insecurity and who deserves a hamper, who doesn't. So lots of those kind of, what is this? What are you doing? And then trying to also navigate our rural specific barriers unique to us. So for Cherryville, we had limited internet cell service access. I remember what I would think I was like 15 or so when we were talking about cell service coming to Cherryville, and it was a really hot topic of like, no, we can't do this. Why are we bringing this into our community? And like, though it was just, I just remember it being such a more political debate of what's going to change our community from then. And so it's gotten better. We do have internet and cell service. There's still lots of residents that don't, but we do have that piece. So that's been easier for, say, sharing information. The cost of travel and how that impacts our low-income residents is huge. So 60 kilometers about-ish is away from our biggest urban center where the hospital is, our more hub for the resources that we would need. So that can be quite a far drive for people who are trying, especially with gas prices where they're at. That can be a really hard barrier to overcome when you're dealing with financial insecurity. Winter and road conditions. So in the summer, you may likely get more supports, but come the winter, those drives are not going to be made as much. We also have lots of off-grid residents, so the driveway or the road to get to a person's house just may be more inaccessible. And for outside members trying to come in, that can be a deterrent. And then cultural factors. So by cultural factors, I really just mean the historical factors unique to Cherryville. So our identity, and lots of the people that live and have lived in Cherryville, they did it to get away from the big city. It's more to disconnect from society, more of that living off the land, off grid. And that as an identity for our community is really when, say, outsiders are trying to come in, it's more met with, oh, who is this? Or why is this coming into the community? There's more scrutiny about it. And so that's what we're going to talk about, why the importance of community buy-in is really essential. But those are just kind of where our foundation of our town and where that started. And that does go back generations. So it's like the historical roots of who we are. So some highlights. Over the years, we've established a really firm foundation as a source of support, and we've seen a real culture shift from that in the understanding and learning. So as the food bank, we used our platform to provide education around food security and challenging biases to normalizing asking for help or needing help. And that was a really great foundation to kind of lay down. And we've seen the merits of that now. A big piece of being able to do that work was engaging supports in community by community. So it's that power of key local stakeholders it's absolutely priceless. Our logo is Cherryville Families Helping Families. This messaging is really huge. So it's to the community by our community. And those local representation is absolutely critical to our success. And we kind of talk about that throughout a lot of this presentation. And then we really tried to mitigate our rural-based barriers from that point. So we looked at the rural-based barriers specific to Cherryville and how to mitigate them. And that's kind of how the Resource Center was established. We recognized that we needed supports and services that went beyond food security. And if I'm quite honest, COVID was kind of a catalyst for us expanding. I've always been passionate about bringing more services and supports to our Asian community, but that moment in our society really brought just how serious that was for us. So during COVID, everything went lockdown, and we recognized that there's no services coming into our community. There's nobody coming out here to support our people. And we have, as we've seen, a high percentage of older adults and some individuals with more complex health conditions that really started to isolate our people. And that got really scary. So we were like, we need to do this. We need to support our people. What are we going to do? I mean, that just started off how we kind of expanded. We had started calling and doing check-ins like, hey, how you doing? Haven't heard you in a while. What's going on? Just simple conversation stuff. And then it kind of just exploded into what we are now today, which is a large range of resources and services. So when we looked at our community, we found high percentage of aging adults, low-income households, as well as a large presence of persons with disabilities, mental health and substance use issues. We recognize that to reduce the financial, the practical, and the psychosocial barriers, we needed to provide services within the community, by the community, in community, because financially and practically, it relieves pressure on individuals. So individuals may not have a vehicle, both maybe because they made some life choices where they don't have a license right now, or they're at an age where they're no longer allowed to drive. And so getting to town makes that incredibly difficult financially because of the cost of going. It gets to really add up. Um, and by community, which accounts for some of those cultural factors and historical roots. So we now have a range of services. We targeted challenges around misinformation and lack of information. And we did that through a newsletter. We print it and mail it to every household. We even drive it to some people that don't get mail or don't have the ability to get it. We put posters up, we blast on our social media. We just increasing access to reliable information on a consistent basis is an absolute pillar of success in our opinion. We wanted to get information to our people, and we noticed that's one of our barriers. So we worked really hard to do that. And it just kind of goes hand in hand. Hey, we're doing a workshop down here. Come down and see who we are, what we're doing. And that just kind of, it's a reciprocal process. So kind of glossed over a bit how we came to be, but in 2023, we received our first seed grant through BC Centre for Palliative Care to offer caregiver support group and increase access to psychosocial supports for palliative Cherryville older adults or those living with life-limited illness. And so the motive behind that is kind of where I want to share. So in the next slide, my passion has always been centered around aging in place. But that also includes dying in place. And so, as we already discussed, rural communities, Cherryville in particular, often have unique barriers, typically centered around their geographical location, finances, and unique historical factors. And these barriers can reduce equitable access to care, which then challenges an individual's ability to truly age in place safely and independently. And often that forces people to make life changes sooner than maybe if they were living in an urban center. So, for example, in our health authority, we have home supports. That's like bathing, med reminders, getting dressed, those kinds of things. It's those personal care, and it can help people stay in their home for a longer period of time. They could get up to 4 times a day home supports when they're really more complex before they have to go to an altered level of care. Well, Cherryville residents, oftentimes we don't get that frequency. We're not getting home supports 4 times a day, certainly not. Maybe once a day would be maybe, or, sporadically throughout the week. So it just is not quite as much care as you could get if you're in town. And so often Cherryville residents would have to hire privately for care, but given the bulk of our residents being below the poverty line, that just is not an option. So when we talk about dying in place, that just becomes an even more complex conversation and often results in a ton of pressure on our families and friends, neighbors, loved ones. Also, I think it's important to know, like, Cherryville has grown up on the outskirts, so that's our historical root. And as such, many of our older adults prefer to die in their own home and in their own community, and having to trade their comfort in that environment for hospital or long-term care, it's almost unimaginable. And so, for example, my grandpa and my grandma, they lived here their whole life. My grandpa had gotten sick. My grandma had dementia at the same time. My grandpa 100% wanted to die in his own home. And we were very privileged in the fact that my mom, so his daughter, was a registered nurse. So she was able to provide lots of that care, bridge that piece. And my family had the privilege of being able to afford private care on top of that so that he could die in his home. Unfortunately, that's just really not the case for many households. And the pressure on families at that point it's so much. And it's really where this compassionate communities model comes into play, and it's working to kind of support that process better. And that's what I love about it. So I'll get into that a little bit. I wanted to provide some validity to this presentation, so I'm not just, spouting off stuff here and there, and just reflect on some of the literature that really does touch on this. So I had taken a palliative course in my master's degree, and that's really where I first learned about the compassionate community model. I had written a paper exploring rural-based challenges and the possible innovative solutions or recommendations that could be adapted and then implemented within a rural and remote sector to support aging and dying in place. So just some of the main highlights here is Ken Alperin, rural communities tend to have higher rates of chronic health conditions, unique challenges to accessing healthcare, and increased health disparities due to socioeconomic, geographic, and other social determinants of health, leading to poorer health outcomes. So we've touched on that. And Cherryville is a great example. Some of our aging population, they're more complex care needs. And so sometimes when they end up also in hospital, they're considered more complex because there's just a lot of outside factors that can't really be mitigated due to our geographical location. Currently, there is no comprehensive national or provincial rural health care strategy to address the needs of rural populations, and a more coordinated response with multi-stakeholder involvement is key. I love the multi-stakeholder involvement is key, and that's one of the things I'm going to be driving home today, because I think it's absolutely imperative that we work collaboratively. It's not one or the other, it's a cohesive partnership. And Cornelson here says implementing a community-driven approach to sustainable rural healthcare planning and creating intentional partnerships between local community organizations and healthcare providers must be prioritized. And absolutely, I fully appreciate that. And Tompkins here kind of drives it in. It's everybody's responsibility to care for each other during times of crisis and loss, and not simply the task of health professionals. So again, it's not one or the other. It really is a partnership, and working with our health authorities, with our community organizations, with our local stakeholders, with our community members, and really bridging that support in so that if somebody wishes to die in place, or what that even can look like, we have at least an opportunity to explore it safely, and where they feel like they're going to have this kind of partnership behind them. Engaging in these movements like compassionate communities is where death literacy is embraced. We can then start conversations about what is needed from rural living residents who are facing death and dying, and how we can respond most effectively. By responding most effectively, this includes engaging and establishing that multi-sectoral collaboration. And yeah, this just starts that something so powerful as this one conversation. It can leads to so much creativity and just support. And I think that this is where we need to be listening to our rural communities and our people that are doing this all the time, so we can hear what they are experiencing and what they think they need, so we can kind of shape public policy going forward, and how we can have a better coordinated approach to mitigating those barriers. So I've talked a lot. I hope I haven't lost you. We're going to do some breakout rooms here. I want to create space for innovation. So in your breakout rooms, I'd like you to discuss some of the unique barriers to your community, and what are some innovative approaches you have either taken or could take to mitigate these barriers and therefore increase access to supports and services.
Great. Thanks so much, Meghan. Okay, so I'm going to split everyone into breakout rooms here. So once you're in your room, feel free, if you want to take just a quick minute to introduce yourselves. We'll give, I think, about 12 minutes, give or take, for some discussion time, and then we'll all come back in the main room here and do a bit of a debrief. So we just encourage you, if there's a highlight that came out of your discussion time, maybe a key theme, or maybe there's a particular resource that someone in your group mentioned that you just really want to share with the rest of the group. We just encourage you, if you have something that you can share with the big group once we're back together, that would be wonderful. So I'm just going to open up the rooms here. It looks like we have 3. And if you have any issues, just let us know. There's a little button that says you can contact the host. But other than that, enjoy your discussion time, and we will see you soon. Hi, welcome back, everyone. Thank you for engaging in that discussion time. I'm going to hand it over to Lisa to help kind of facilitate this little bit of a debrief time. And Meghan, you're welcome to kind of jump in and answer any questions that come up as well.
Yeah, so thank you, everyone. I had the privilege of sitting in a group and learn about some really neat innovation that's happening in the communities. So what I would like to invite people to do is, maybe just put in an idea or a point that you'd like to make, or something that you learned within our breakout room sessions. Any unique innovative ideas that you thought about that address some of the barriers in your community. And I heard quite a few great ones as well. Maybe Jenny? from the Sunshine Coast. You had a wonderful idea about a fund for counselors as opposed to having counseling on staff. And maybe you could speak about that. I found that was a really great, innovative idea. And I noticed a few people were interested in that.
Yeah, so we're we're a community-led hospice here on the Sunshine Coast, on the lower coast. So we don't have any counselors on staff. In fact, there's only been staff for about 4 years, and the organization is over 35 years old. So what the organization did is identified, like, we need counseling support. So developed what we call the Complicated Bereavement Fund. It was initially designed for people who were arriving at hospice who had complicated grief. And that's expanded now. So we contract counselors in the community. We currently have 9 counselors on our roster. And so what that means is that, as I said in the group, a 25-year-old woman is not necessarily going to vibe with a 60-year-old man. And so what it allows us to do is match individuals with a counselor who can address their particular needs, who, where there's some synergy either in like similar season of life, etc. So like we have a counselor who only works with men, which is amazing because then I send all of our male clients there. We have a counselor who works with grief that's been complicated by substance use, death by suicide, traumatic death, MVAs, that kind of thing. So it's great. And I mean, like, I've got an equine therapist, I've got a sound therapist, and then I've got sort of traditional counselors in between. So it's complicated. And I saw there was a question, complicated grief is where the grief becomes complex. And it could be lots of different things. It could be an out of order death. It could be a traumatic death. It could be that there was a history of substance use, either with the person who's died or with the person who's grieving. It could be that there's been a number of deaths or any kind of trauma surrounding it. So it's a really valuable program. It's fully funded. And if anyone's interested in how we've structured it, I'd be very happy to talk to you. For communities like Pender Island, you could do online. You could get therapists online. We focus primarily on therapists here because there's many, many people, but yeah.
And how did that funding come, Jenny? The initial funding, donations or
I think it's sort of a mix of grants, private funding. Yeah. So.
Any other questions? Anybody else want to talk about some great idea that they have or learn from somebody else here in the session? Maybe a question for Megan at all?
I was really interested in hearing about the palliative care training and support that was happening in the Sunshine Coast, the 35-hour training, and how that works for bringing in volunteers for that.
Yeah, I think most hospices are doing a pretty robust training program of some kind. It's usually in that range of 30 to 40 hours. So we reach out to community. We only take about 16 people a year. That may change. But if you wanted to learn more specifically about the training and the things that we put into it, please let me know. I'll put my email and you can email me and I'll connect you with our volunteer coordinator. So there is some suggestion right now at a provincial level, there'll be a standardized volunteer training. And the experience of rural communities differs vastly from what is happening in a city like Vancouver or Victoria or Surrey or Delta. And so our training is very much geared to the fact that we are in a rural community. We are one of the most senior communities in BC, and we have very unique and specific challenges. So
no, that would be great. We don't have hospice here on Pender at all. So, that's not something that we can access locally. I would be very interested in what you've done there.
Great. Any other new innovative ideas that may have sparked during our conversations? Anybody doing something new to really address some of these challenges in rural communities that you'd like to put into the space? Oh, Nancy, jump in. Just get you to unmute, Nancy.
There we go. We didn't actually talk about this in the in our breakout room, but I'm really proud of what we've done here on Galliano. And I didn't catch your names, folks from Pender, but we should be in touch. I work at the Galliano Healthcare Center, and we just finished and are about to start placing volunteers in our home hospice program. And Jen is quite correct, and we have a very unique situation because we're not a hospice. We're a community health center, and we don't have a brick and mortar building. And I think that's one of the most innovative things that we've been able to do on the island here in a while. And it's astonishing as people are finding out about this. They're very interested in getting services. So yeah, it's quite exciting. And our training program was really developed after talking to multiple different organizations. I'm a member of the Vancouver Island Federation of Hospices, and so there's been some really cool people who've given me lots of great ideas, and so I'd be pleased to talk to you about our program and what we've done here.
Thank you, Nancy. We'll reach out to you.
Yeah, please do.
And Nancy does have a great program. I'll just put a plug in for you there, Nancy.
Well, thank you very much. I know it's we were so lucky to get some seed funding that's really helped us on our way, and yeah, we're very, very grateful to the support that we've got so far to get this going.
There will maybe more activity on Pender than Ann and I are aware of, but it's still very valuable information. So thank you.
Well, and check with Jane Harrison because she's got all my contact information, because I also run the Better at Home program here.
Excellent. Thank you.
Great.
You're welcome.
I'm curious if there's been any barriers around like using a ferry, if you need a ferry, and how that impacts your community, and if anyone their communities are looking at virtual care or connecting with doctors virtually and such. Has anyone kind of working on those things?
Have you ever tried to work with BC Ferries?
No, but thank you for sailing with BC Ferries. It's been a pleasure. They're like, when they work, it's great, but they don't come very often. To Pender's gets more ferries. Pender and Salt Spring get more ferries than we do. But you know, today, for example, the early morning boat that left from Swartz Bay was 72 minutes behind schedule. So,
Yeah, and I think, sorry, Nancy. I think apart from the actual challenge with the ferries, we had a public health meeting, community meeting here on Sunday or Saturday. And one of the things that came up is that when we go to town for a procedure that requires, you know, even going in as a day patient to a hospital, it requires you to stay overnight, right? Because you often have to go back the next day, or the times don't work and so on, which is becoming quite prohibitive for anybody who doesn't have the financial resources to pay for hotel rooms. So that was flagged as, you know, an issue that is becoming a bigger issue, because it's rumored that hotel rooms in Victoria this summer will be minimum $500 a night, et cetera, which is easy to believe because they were that last year.
Yeah. And we don't have reservations from here to Swartz Bay either. Even if you've got a doctor's appointment, you're not guaranteed that you're going to get on the ferry that you need to get on. So,
well,
yeah.
and frequently for the outer Gulf Islands, if you have a doctor's appointment at 9:30 or you know, a X-ray, whatever, you have to catch the boat that leaves at 6:30 from Galliano.
Yeah.
And then there isn't one that gets you home until after 6. So you spend 12 hours in a day just because you needed to have a CAT scan or a ultrasound or
Mhm.
something
You
like that.
Okay.
So
Yeah.
Yeah, thank you. Thank you so much, Nancy. So we're getting short on time. So let's turn back to Megan so she can finish her presentation, and then we'll get some questions in afterwards as well. Thank you, everyone.
Yeah, I also just want to say too, the impact of the health on if you have any health challenges to go all that long time, you'd be so tired. And is that really realistic for somebody? So ferries and that transportation piece really is a unique barrier. And I like to hear that piece because we really need some more support in planning around that. Okay, really quickly, I know I've been taking up a lot of time. So, our Compassionate Communities project, this is what we did. We plan to offer a caregiver support group and provide psychosocial supports to residents living with life-limited illness or disease, chronic health conditions, or complex frail adults. We needed to be flexible because we did not get much interest in the caregiver support group. But we did have a lot of traumatic loss in our community over the summer. Some really tough suicide, substance use related deaths, and that really shook our people. So we pivoted and we offered a grief support group instead, and it really had a ton of buzz. And it's interesting, some of the ripple effect that came. So I'll explain that a little bit further in a sec. So some of the results were we were able to meet with 11 individuals who met the above criteria, and offered a range of psychosocial supports. That included like meeting them in their homes, seeing them and their family when they went to hospital, and just kind of providing that bridge piece, arranging volunteer services, system navigation support through advocacy. Luckily, I also have a other job where I work through the health authority, so I kind of know all that background information, so I can say, okay, this is what you're going to do here. This is how we're going to get through that piece there, and just that sense of extra person supporting, and that took a lot of the pressure off our families. And honestly, lots of times couldn't do anything, but just saying hi in hospital was such a huge impact for people, where they felt like they were heard and just being along for the ride, right? I'm just there for the journey. I can't offer anything, but I'd like to sit with you during this difficult phase. And the impact that had was really, really quite well received. So our grief group really was a huge success, and there's a lot of interest for that to continue on. We don't have things like that in our community, so that was really cool. But the most notable success for us was the openness to discuss the end of life and death. So normalizing these conversations allows death literacy to expand, and that is a beautiful thing to be part of. So it's been a reciprocal process between our organization and community. So hosting that grief group really did have a ripple effect than I ever had anticipated, because clients engaging in our other programs say they came for a hamper. They were saying, oh, I'm just here to get hampered, but hey, what's that grief group going on? What's going on there? And then our frontline staff being like, oh, yeah, we're doing this thing, and it's part of this Compassionate Communities program, and this is just kind of one of those pieces, and it sparked this conversation, which then, they're not a part of the grief group, but now they're talking about some of the challenges that they're going through, and then our staff being receptive and having those meaningful conversation. It just kind of snowballed in really that ripple effect that I wasn't really expecting, just from simply providing something. And we may not have had as many people here, but it reached way more than actually registered. And I thought that was a really neat, and it just, yeah, the power of a simple conversation, that things can kind of come from it that you would never expect. And just being that presence about being open about discussing the end of life. What does death and dying look like in our community? What are you going through, and how can we see if there's ways to support? And just kind of being there, I thought was really neat. And I think as a whole, our organization is kind of now finally understanding what it really means to be a compassionate community and our role within that. And it really is simply is just being a starter for conversation. It's powerful how much a conversation can do. Lastly, we've started to create and explore really new partnerships that have already started to be a catalyst for change and growth within both our organization and our community. So just a couple of them: North Okanagan Hospice Society has been a beautiful connection to make. The executive director there is a massive supporter of ours, and it's just been amazing to kind of start conversations. We've teamed up with paramedicine and have met individuals in their homes together. Currently collaborating with a pharmacy in Lumbee, it's about 30 kilometers away, to reduce barriers, to increase access to medications in our community. And that's really exciting. And it's just the beginning of some of these conversations with our surrounding partners. And it's because of this Compassionate Communities project that we've been able to just expand those conversations. And it takes time. So my recommendations: buy-in takes time. It's important to have a strong local representation throughout the planning and implementation of what you'd like to achieve. So find your local community champions and rope them in from the very beginning. It is going to be a huge piece for success. And take heart that if it doesn't seem right now is the time, that happens. 10 years ago, I tried to create a resource center out here and it was not time. We needed a better foundation of trust and we needed to grow. But all those conversations were still happening. And then now the timing is right and it just flourishes. And when you have something that's the right timing, it'll go. And sometimes you just need to adapt a little bit and then come back to that later when everyone's understanding what you're doing. And so take heart in that and be flexible. That's my other recommendation. Listen closely to what your locals are saying and be willing to adapt. If I stuck in my heels and I just went with the compassion, we're going to do a caregiver support group, and I never adapted and really listened to what at that moment in our chapter, what the needs of my community were, we would have missed out on a really, and arguably one of the best pieces of this entire program or this entire project. So being flexible and really listening to who's in your community can really make all the difference. So in conclusion, what I've learned from the Sea Grant process is that Cherryville has always been a compassionate community. We are simply tapping into the heart of our community and organizing opportunities for individuals to better support one another. I truly believe that anyone can integrate the compassionate community model into their neighborhood, regardless of geographical barriers. Sparking a simple conversation about end of life and values has all the ingredients to transform ideas of compassion into meaningful community projects that can change the landscape for generations. So thank you so much for coming. I so appreciate the time. I'm happy to, if we have time, have some questions and answer at the end. I really appreciate everyone that's come today, and I just absolutely love this conversation. So I hope this sparks more conversations in your communities and some innovative things can come down the way. So thank you.
Yes, thank you, Meghan. Wonderful presentation, and the conversations that have happened in the breakout rooms and then when we came back have been great. We have about 4 minutes if people want to ask Meghan some questions about their program and what her experiences have been in developing a compassionate community in Cherryville.
Can we hire your artists or maybe license like that nice visual right there?
That's a nice sign, hey? Again, another local artist, craftsman. It's beautiful work. And that, yes, we love that sign. It's finally coming up. It's been a long time waiting, but I think it just really shows and captures, the really unique sense of our community as well. So thanks for the shout out for the sign.
Okay, great. I just want to quickly jump in and mention to everyone that the BC Centre is having an all-together symposium on October the 4th, 2024. It'll be hosted in Vancouver. The details can be found on our website under the events tab. And this symposium will be focused on bridging the gap between healthcare and community systems and community organizations. So we look forward to welcoming all of you to the symposium, and we'll be reaching out to a few of you in the near future about potentially contributing to the symposium. So please take a look at that event on our website. I would have had a slide up here for you, but I neglected to do that. So again, we're really excited about this event coming up. And thank you so much, Meghan, for presenting today. We have about 3 minutes left, and I see a hand up from Patricia. If you'd like to go ahead and ask your question.
Yeah, thanks, Meghan. That was really, really great. I'm just wondering if you've had any, like, how you kind of get around that barrier of like talking about death and dying and end of life. Like we find with our Compassionate Alberta project, like as soon as you kind of mention death, dying, end of life, people just, oh, I don't want to talk about that. Have you found better kind of ways of engaging with people or better messaging to kind of draw people in, or what's been your experience there?
Yeah, that's a great one. And I bet you there's people here that have done this much better. Mine, I keep thinking like the death cafes that I've heard, and that being a really successful piece that I'd love for somebody if they have that to talk about it. For us, yeah, that's a tough topic to kind of bridge. Hey, I found just in our communication, in our newsletter, in our printed materials, just having that grief group like just that as a conversation starter, it was non-threatening. It's like an inviting ways. You don't have to talk about it. We're not jamming it down your throats, but hey, there's just something weird that we're doing over here, and it's talking about grief. What does that look like? And then that was a good non-confrontational way to start those conversations. And it really, like, if individuals want to talk about that, they do it. I'll say it's funny, just even just doing this grief group and just kind of doing a little bit of promotional work there. There was a woman that just drove straight to our organization, and she was like, my loved one just died a couple weeks ago, and I just didn't know where to go. I just had to drive somewhere, and I don't know. I just came here. And it just obviously the messaging of, hey, we're a place that's just open. And if you are going through anything, our doors are wide open from these times. Come on in. It obviously resonated with some of our community members, and just come sit down and just have that moment. So I think just being a presence and having that willingness to share something maybe like different, innovative, a death cafe, or something that's not so terrifying, it let that resonate for a while. And I think you'll see the impact of that. People will come to you when they're looking for that, and it gets shared, and you may not realize who's watching, but there's lots of people who are watching and sharing that in the background, and you see that come out in unique ways. So that's been my experience.
Thank you, Megan. So that brings us to 2 o'clock. Lots of questions. Thank you so much, everyone.
Thank you.
Thanks.
Okay, so thank you again for joining us. Thank you, Megan, for donating your time to present this session. Very informative. Thank you, everyone, for joining us over your lunch hour, and have a great rest of the day. And please reach out if you have any questions.